This video will cover acute monocytic monoblastic leukemia. Let's anchor ourselves. To first of all remember that this video refers to AML, we have to notice the amulet that the character is wearing. The word amulet, if shortened, could be written as AML, right? Our symbol for monocytes is a monorail train, just like the one going around the store here. And there's some type of huge sale going on in this store. They call it the explosion sale, where 80% is off everything. This explosion sale banner next to the monorail train will remind us of monoblastic. Now that we're anchored, we can talk about how monocytic differentiation is seen in more than 80% of non-erythroid cells. The 80% threshold is again represented by the sale here because they're giving an 80% discount. Let's cover the immunophenotype. We've got our doctor here who works for the HLA health system and therefore represents HLA-DR expression. CD4 is expected to be positive and is represented by the door entrance. The word door sounds like the number 4 and that's what we're going to use. But let's kill two birds with a stone here. You see these sticks that are taped to the door? The word sticks sounds like the number 6. Put the sticks together with the door and we'll remember CD64. CD11B is also expressed and is represented by the leather bonnet that the character is wearing. The word leather sounds like the number 11 and the word bonnet starts with a B, just like the letter B in CD11B. CD14 expression is represented by this fortune chest because the word fortune sounds like the number 14. The chest is also even full of CDs to hammer the fact that this refers to CD14. Lysozyme is expressed and is represented by this crushed can of Lysol. In previous videos, we've used a can of Lysol as a representation for lysosomes. Well, don't enzymes break things down? So to help us remember lysozyme, we'll just remember this broken down and crushed can of Lysol. CD34 is usually negative. If you remember our symbol for CD34 positivity, it's a dirty door because dirty door sounds like the number 34. We don't have a dirty door here, but we do have a super clean, shiny door, which is the opposite of dirty, right? This is going to help us remember negative CD34. This AML presents with bleeding disorders and some degree of soft tissue infiltration, notably gingival enlargement and CNS infiltration. You see where I'm going with this one, huh? The gummy smile this character is showing will help us remember gingival hyperplasia, and obviously his abnormally large head will remind us of CNS infiltration. Prognosis for this AML is generally poor. Our character who is wearing the amulet does not look so happy, does he? His demeanor will remind us of the poor prognosis.